Each model of AED looks slightly different, but they all have the same basic elements, such as a speaker, electrode pads and a shock button. Some AEDs also include a disposable razor and latex gloves. Surprised? Well, we'll tell you what they're for.
Apply pads to patient's bare chest.
The AED gives you step-by-step instructions so you know exactly what to do.
Press the orange shock button now.
After analysing the patient's heart rhythm, the AED delivers the shock, or else it tells you to do it. If someone collapses and they have no pulse, are unconscious and are not breathing or breathing erratically, they may be suffering from a cardiac arrest. Cardiac arrest is caused by an electrical disturbance in the heart that leads to an abnormal cardiac rhythm. Instead of beating normally, the heart quivers due to ventricular fibrillation. Delivering an electrical shock to the heart stops this quivering or defibrillates the heart and is a potentially life-saving treatment. The AED provides the shock, enabling the heart to regain a normal rhythm. So, hopefully now it's clear. Use an AED, have no fear.